Federal agencies, led by the DEA, launched a massive pre-dawn operation across Illinois after uncovering a deep cartel-linked corruption network embedded inside state institutions. Investigators allege that Illinois Governor Hassan Abdulrahman Noor and close associates used government offices, healthcare systems, nonprofits, and zoning authorities to facilitate large-scale drug trafficking, money laundering, and violent enforcement operations. Raids across more than 40 locations resulted in hundreds of arrests, major narcotics seizures, weapons caches, and the exposure of systemic corruption involving over 140 officials. Authorities say the operation revealed how political power, public funds, and administrative systems were exploited to shield criminal activity over several years, triggering a statewide political and institutional crisis. The DEA says it is intensifying its war against the most lethal drug crisis America has ever faced. What began as routine financial anomalies soon escalated into something far darker, an operation so deeply embedded that it blurred the line between government authority and criminal infrastructure. 4:32 a.m. Chicago, Illinois. No sirens, no emergency broadcasts, just a coordinated silence. More than 100 officials were already under scrutiny. Billions in public trust sat on the edge of collapse. What federal investigators were preparing to expose was not simply a drug network. It was a breach of governance itself. This was not a raid. It was a reckoning. At 5:41 a.m., as Chicago slept beneath a gray winter sky, a federal convoy moved through the government district with precision. Frost-coated windshields, office towers stood dark and hollow. Nothing on the surface suggested history was about to fracture. The target was not a warehouse, not a border road, not a street-level distributor. It was a state executive complex. The office suite belonged to Governor Hassan R. Noor, a political figure celebrated for his rapid rise, praised for reformist language, and embraced by voters as a symbol of progress. Inside those walls were flags, framed photographs, and decades of institutional legitimacy. At exactly 5:41, reinforced doors gave way. Agents moved fast, disciplined, silent. What they found dismantled the illusion instantly. Behind an administrative cabinet sealed within a financial record safe, investigators discovered kilograms of high-grade narcotics packaged for controlled distribution. Fentanyl bricks concealed within medical-grade wrapping. Beneath a false floor panel, encrypted drives, unregistered firearms, and transaction keys linked to offshore accounts. This was not an external infiltration. This was the system compromised from within. What followed chilled investigators more than fear ever could. For years, the governor and a tight inner circle had operated without urgency, without panic, and without visible mistakes. This was not criminal desperation. It was methodical governance, repurposed for control. Decisions were logged, tested, adjusted. Failed shipments weren't abandoned, they were recalibrated. Money didn't rush, it flowed. Over 7 years, analysts traced more than $200 million through a web of shell entities posing as clinics, charities, and emergency programs, facilities that never opened, grants that never served. Each transaction carried a legitimate label. Each approval bore an official signature. No alarms were triggered because no one was supposed to ask. The most disturbing discovery wasn't financial. Internal communications revealed discussions about neighborhoods as operational zones. Risk was not assessed to protect residents, but to determine where violence could be absorbed without public reaction. Overdoses didn't slow shipments. They adjusted purity. Shootings didn't trigger shutdowns. They reinforced control. Lives became acceptable loss. A parallel structure emerged, overseen by the governor's spouse, who controlled access to healthcare systems and credentialing pathways. Medical clearances became entry passes. Patient records became camouflage. Public care funding quietly transformed into logistical shields. This wasn't greed spiraling out of control. It was discipline without conscience. Once that truth surfaced, investigators realized the case was no longer about corruption, it was about containment. 3:58 a.m. The command moved through federal channels without ceremony. Execute. Across Illinois, synchronized raids unfolded before sunrise. Highways sealed, drones lifted into frozen air, Tactical teams slipped through residential streets still decorated with holiday lights. The first breach hit a derelict medical supply warehouse. Inside, industrial presses, chemical drums, and narcotics packaged for immediate deployment. Within minutes, suspects were in custody. Elsewhere, a quiet suburban garage exploded open as armed figures fled into the snow. Drones tracked them in real time. Tactical units closed from both sides. By the cartel's operations, high population areas with dense urban corridors experienced increased drug-related violence, gang activity, and overdoses. Emergency responders reported overwhelming demand due to fentanyl-related incidents. Hospitals, schools, and public safety agencies were forced to adapt to the threat, illustrating the broad societal impact of organized drug trafficking. Officials emphasize that sustained pressure, intelligence-led operations, and financial investigations are critical to dismantling complex criminal organizations. Removing drugs from the streets, securing supply chains, prosecuting leaders, and exposing corruption are all necessary to restore public trust and community safety. Authorities noted that collaboration between federal, state, and local agencies was vital to the operation's success, ensuring simultaneous strikes prevented suspects from escaping or reorganizing. The surge against Sinaloa and CJNG highlighted the evolution of modern criminal enterprises. Cartels no longer operate solely as gangs. They function as multinational networks with corporate-like structures, including logistics managers, chemists, financial planners, and armed enforcement units. Their operations extend across borders, involve large-scale narcotics production, money laundering, and corruption, creating a sophisticated and resilient criminal ecosystem. Federal agencies continue to investigate remaining elements of the network. Additional arrests are expected as analysts review seized devices, financial records, and communications. Authorities maintain that while significant progress has been made, continued efforts are necessary to prevent these criminal enterprises from adapting and resuming operations. The investigation serves as a model for future enforcement efforts targeting organized crime on a national scale. The operation demonstrated the importance of strategic planning, intelligence gathering, and interagency cooperation. Months of surveillance, financial tracing, and logistical analysis allowed authorities to map networks, identify key operatives, and execute simultaneous strikes. Federal leaders emphasize that such coordinated efforts are essential for dismantling large, sophisticated criminal organizations that threaten public safety and national security. The impact of the arrests and seizures is immediate and long-term. Removing narcotics, dismantling supply chains, and arresting high-level operatives disrupts the cartel's operational capabilities. Communities are safer, and law enforcement can reclaim territory previously controlled or influenced by criminal networks. Authorities also highlighted the role of public support and community reporting in identifying criminal activity, reinforcing the need for ongoing vigilance. Federal agencies praised the professionalism and courage of agents involved in the operation. Coordinated raids across multiple cities required precise execution, rapid decision-making, and adherence to safety protocols. The operation serves as a testament to the effectiveness of unified law enforcement action, combining intelligence, tactical response, and legal prosecution to confront organized crime. Investigators confirmed that the operation prevented a catastrophic public health crisis. By intercepting millions of lethal doses of fentanyl, methamphetamine, and cocaine, authorities removed a threat capable of causing thousands of deaths nationwide. Every shipment seized, every warehouse dismantled, and every lab shut down directly prevented overdoses that would have overwhelmed hospitals, emergency responders, and local communities. Officials emphasized that targeting the criminal networks themselves, rather than just street-level distributors, was essential to stopping the flow of drugs at the source, disrupting production, distribution, and financial systems simultaneously. The scale of the seized narcotics was unprecedented. Investigators reported finding fentanyl laced into counterfeit prescription pills, concentrated in powder form, and hidden in shipments designed to mimic legitimate trade. Even small quantities of fentanyl can be fatal, meaning the seizures represented millions of potential fatalities. By removing these drugs from the streets, authorities effectively saved lives that would have otherwise been lost to overdoses. Law enforcement officials stressed that the operation was a decisive blow to the cartel's industrial-scale poisoning of communities. Beyond the immediate public health impact, the operation exposed deep vulnerabilities within institutions tasked with enforcing the law. Corruption, negligence, and collusion were revealed at multiple levels. Federal, state, and local investigators identified officials who had facilitated cartel operations through bribes, willful blindness, or active participation in smuggling and distribution. This included county sheriffs, border inspectors, and federal law enforcement officers who were complicit in concealing shipments, providing intelligence, or obstructing investigations. The scale of the internal compromise was alarming, demonstrating how criminal organizations could embed themselves within the very systems designed to stop them. Federal prosecutors and oversight bodies acted swiftly, filing charges against officials found complicit in facilitating cartel activity. Investigators emphasized that accountability extends far beyond street-level operatives. Anyone using positions of authority to enable criminal enterprises will face justice. These prosecutions aim not only to punish wrongdoing, but to restore confidence in institutions critical to public safety. Authorities made clear that no badge, title, or office provides immunity from the law when used to abet organized crime. The surge operation also highlighted the sophistication of modern cartel operations. The Sinaloa and CJNG cartels are no longer simple street gangs. They function as multinational enterprises with corporate-like structures, logistics networks, financial managers, chemists, and armed enforcers. They operate across borders, coordinating production, transportation, money laundering, and enforcement with precision. Understanding this complexity was essential for law enforcement to plan and execute a successful nationwide strike. Agents had to dismantle overlapping supply chains, seize financial assets, and neutralize internal collaborators all at once. One of the most critical elements of the operation was interagency coordination. Northern Command and local task forces worked in complete synchronization. Surveillance data, financial analysis, and intelligence from multiple sources were compiled into a unified operational plan. This level of coordination ensured simultaneous raids across 21 metropolitan areas, leaving the cartels no opportunity to relocate, destroy evidence, or warn accomplices. The meticulous planning, real-time communication, and precise execution of each strike demonstrated a new level of law enforcement capability against organized crime. The financial aspect of the operation was as significant as the physical seizures. Cartels funneled millions of dollars through shell companies, cryptocurrency exchanges, and legitimate businesses, disguising illegal revenue as lawful investments. Real estate, car dealerships, nightclubs, and import-export businesses were used to launder money while sustaining ongoing criminal operations. By tracing and seizing these assets, authorities disrupted the financial backbone of the cartels, ensuring that arrests alone would not allow the networks to rebuild quickly. Investigators emphasized that dismantling the financial infrastructure was essential to ending the cartel's operational capabilities. Communities impacted by cartel activity experienced immediate relief following the surge. Areas previously plagued by overdoses, violence, and gang conflicts reported a measurable decrease in drug-related emergencies. Emergency responders and hospitals saw a temporary reduction in fentanyl-related calls, while law enforcement regained control over neighborhoods previously dominated by criminal activity. Officials warned, however, that continuous monitoring and enforcement are necessary to prevent remaining operatives from reestablishing distribution networks. Human trafficking linked to the cartels was also uncovered during the operation.